Hello, my name is Dr. Rebecca Estes, and I'm on the faculty at the University of South Alabama in the Department of Occupational Therapy. I'm honored to share my enthusiasm and my interest in occupational therapy with you through a response to a series of questions. So let's start first with the degree. The University of South Alabama offers a Master of Science degree in occupational therapy. Other universities may offer a Master of Occupational Therapy or a clinical doctorate degree. But all programs offer degrees at the graduate level because that's required for education for an entry-level occupational therapist. Now, we do have a 2-year degree, which is called an Occupational Therapy Assistant. But this presentation will focus on the graduate degree in the occupational therapist. So, no matter what age we are, we all have a job to do, the job of living. Occupational therapists believe that the term occupations encompasses everything in life, from living to learning, growing, playing, working, managing our homes, taking care of ourselves and our families. But unfortunately, sometimes people have physical, emotional, or other challenges that prevent them from fully participating in that job of living. So, occupational therapists work with clients who have orthopedic, neurological, environmental, psychosocial, or cognitive challenges. And we work to facilitate them to be independent in their life activities that are important to them. So, by choosing a career in occupational therapy, you will make a difference. You will be able to improve the lives of people from the very young to the very old. What setting does an occupational therapist work in? Well, one of the reasons that I believe occupational therapy is an absolutely awesome career is because of the wide variety of opportunities available to graduates and professionals. So you might decide to work with children in their occupations of childhood, including learning, playing, and growing. Therapists work in pediatric neonatal intensive care units, for example, with premature babies, trying to position them optimally to enhance their development and growth. You might work in the homes of children with cerebral palsy, Down syndrome, or other disorders, through early childhood intervention programs, or with students in schools that have learning disabilities or behavioral disorders and problems. You might work in a hospital or a private practice setting with children, treating a variety of other childhood conditions. For example, a child that has sensory integration disorder. You might work with them to be able to teach them better balance skills so they can more appropriately interact with their environments. On the other hand, you may choose to work with adults or older adults in their homes, in community centers, in rehabilitation hospitals, with businesses, or in nursing homes. In these settings, occupational therapists help people with traumatic injuries, stroke, Alzheimer's disease, or mental health problems. We want them to learn to live productive lives through the use of meaningful occupations. So, for example, we might work on personal care skills, such as being able to reach at a distance, high or low. We might work with adapted dressing, being able to reach your shoes and put your shoes on if you're unable to bend down, or to be able to put your socks on if you're unable to reach down for your socks. So we might be able to work with people who are unable to independently eat. We also work with people to make sure that their hands are functioning maximally. So we often provide splints that might be necessary for an individual who needs to rest their hand because of an injury, an individual who may have different kinds of contractures or need positioning in order to prevent deformities, or an individual who may need a splint to enhance their functioning. Other areas of practice are also available to you. Newer specialty areas, such as training people in industry settings to use proper ergonomics on the job, helping people with low vision maintain their independence. For example, teaching people to be able to use a magnifier at home to do their daily occupations, such as being able to read a medicine bottle and the instructions on the medicine bottle, or being able to write and complete a check. Other specialty areas available include assessing and making buildings and homes more accessible to people with disabilities, older driver training and education, and promoting health and wellness. It sounds like a good profession to be in, doesn't it? At the graduate program, the overall requirements are mandated by our accrediting body. In general, you'll take courses that cover basic tenets of occupational therapy, including the history and philosophy of OT, the meaning of occupation, the importance of health and wellness, how disease, disability, and injury, and other conditions impact an individual's ability to perform life tasks, understand the cultural, physical, social, personal, and other aspects of context of people's lives. Other courses will focus on occupational therapy theoretical perspectives, how they evolved, and how they're used in the practice of occupational therapy. A large portion of your educational program will be on the process of occupational therapy, how to screen clients, how to evaluate their strengths and weaknesses, and develop an intervention or treatment program. Finally, how to recognize the appropriate timing for discharge, follow-up, and any kind of home visits and programs. The classes include lecture components, but a significant amount of your time will be spent in lab settings and problem-based learning settings where you will practice and demonstrate the skills that you're learning. There's also an important aspect about occupational therapy at graduate education, and that's learning about supervising others. Remember, I talked about that 2-year degree? As a graduate entry-level therapist, you will be required to supervise others that you oversee. You must be able to adhere to the standards and the ethics of the profession, as well as be able to develop and manage programs. Finally, in the educational aspect, there's the research component, vital to a student's ability to recognize, access, and contribute to the profession's evidence-based practice of occupational therapy. A very large component of the learning experiences is fieldwork education. Programs primarily have 2 levels of fieldwork. The first level is observational and is completed along with your academic coursework. The second level is the completion of 2 3-month placements during which the student is under the supervision of a licensed therapist in the field, learning and applying the skills that they learned during the academic portion in order to demonstrate their ability to be a competent occupational therapist at the entry level. The licensure exam you may take after you've successfully completed a program with the National Board examination, and once you've passed, you can apply for licensure in the state of your choice. All 50 states are regulated, as well as the District of Columbia, Puerto Rico, and Guam. So finally, who should be an occupational therapist? Should you be one? Are you creative? Are you a problem solver? Do you enjoy working with people? Do you do well in school? Perhaps a career in occupational therapy is for you. How should you prepare? Well, in your undergraduate program, you might consider majoring in any one of a variety of areas, in biology, in kinesiology, psychology, sociology, anthropology, anatomy. Any of those areas will help you have some of your strengths. But be sure to contact the program that you're interested in applying to make sure that you are getting the required prerequisites and that you have the supplemental experiences that may enhance your application over others. Observation is also vital. You want to go and observe therapists in the work setting. Observe as broad an area as you can, looking at pediatrics, at older adults, at adolescents, in nursing homes, schools, hospitals, and rehabilitation centers. And finally, where should you go? What university should you choose? You want to look at the size of the university, the size of the program. You want to consider the mission of the university and the program. Think about the ratio. How many students are there per instructor in the lecture classes and in the lab classes? You want to think about the geographic location. You want to think about program outcomes. Every program is required to put on their website what the first-time pass rate is for the past 3 years. That's the first-time pass rate on the national board exam of their graduates. So you can look forward to a dynamic career in occupational therapy with a broad variety of options to direct your career. Do you possess the abilities to become an occupational therapist? If so, you might want to join us and become an occupational therapist. I appreciate your time. Thank you for joining me. Here are some national resources you may want to explore for additional information.